Hi everyone, welcome back to XGate Dental. I'm Emmanuel Kadosh, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases, so let's get started. Today, let's take a look at this case. There was a bar on multi-units, and we want to change the overdenture on a bar to form a monolithic zirconia bridge. The bar broke down, and this is why we want to change it. This patient is a little bit more problematic because of the fact that they have Parkinson's disease, and it's very difficult to take impressions and work with that. And because many of the movements of the jaws, he breaks everything. It's something like bruxism, but it's something a little bit different. These are the implants that he has right now. He had a bar with overdenture for about 15 years, and the bar broke down. This is what it looks like. This part of the bar is missing. You have the other parts of the bar. We can take it out and make impressions with the intraoral scanner and then make the full zirconia bridge. Now, due to the Parkinson's, he applies a lot of pressure on the restoration, and we need to make the restoration from the hardest zirconia material that's possible because we want the zirconia to be the toughest one. We don't really care about the aesthetics here, and this part is probably the major factor here because we want it to be as strong as possible with less plaque retention as possible. So we polish the zirconia without glaze at all. Monolithic is the strongest zirconia that you have and is the least translucent. It's just like white bulk of the zirconia. This is the bar that he had with an overdenture on a multi-unit. We took out the bar, we changed the multi-units from old ones to new ones, and the buccal implant, we changed it to an angulated multi-unit because first of all, you don't really see it because we have enough gingiva. That's what we always talk about. When we have enough gingiva, it doesn't really matter that you put and get multi-units because it doesn't affect the aesthetic. And second, the aesthetic here is not the major issue. So if we want to be as strong as possible, this is the most reliable that it can be. We scanned all the multi-units. You can see that in the posterior parts, you have two scan abutments and they get one into the other. You can't restore it this way, but you can't scan because you need to have all of the scan abutments in the same place. Later on, when you model on XGate or 3Shape, it doesn't really matter. You can use only a part of the scan abutment. It doesn't really matter if you have all of the scan abutments or not. And it doesn't really matter if you have all of the scan abutments or not, because even with about a third of the scan abutments, it's enough for the scanning to be done. In our clinic, we already have a couple of cut scan abutments that we sterilize and use in these types of cases that you don't have enough space for a scan abutment, that the implant are adjacent to one another. You can see here that we didn't add any implant. This is what he had. You can see, first of all, that we took a scan from the overdenture that he had. We scanned the overdenture, and then we're using the palatal area. We can connect the denture, the jaw, with the scan abutments because we have the same palatal. Then we can design the bridge to look more or less like it's all a denture. It can get the correct relation, but still we need to be sure that the correct relations and the old dentures that he got can make the same design. This is the denture. What we did is we scanned the denture with the lower teeth. This way we have the relation between the denture and the teeth, and then we scan the palatal surface with the scan abutments and we can attach them one to another. You can see the denture wore off, and you can see that all the indentations from the lower teeth because of all of the grinding that was done to the denture. This is the bar that he had and that we removed. This is the zirconia bridge. It's polished without any glaze. We don't want it to accumulate plaque because at some point that will probably come into the near future. He won't be able to brush his teeth or it'll be difficult for him to brush his teeth. So you want it to be as easy as possible to maintain. And this is why you make the bridge from full monolithic zirconia without any glaze. You just polish it up a little bit, and this is after the healing process. Right now, in this case, we will cement the sleeves inside the mouth for the prevention of the bridge. And you can see the end result, and this is what we have. The aesthetics here are not the most important thing because we want to do it so that we make these restorations as comfortable as possible and as, of course, easy to maintain. And we won't change anything drastically. This is the old multi-units and the bar that broke with the denture. All of the stuff that we got out and changed, and this is the new bridge. You can see that we cemented it in the mouth, and you can see small gaps in the sleeves that we showed that will later on just close the gap with composite material and then polish them. Inside the mouth, we did eventually add a little bit of glaze in the exterior parts, but you can see that all the gingival parts and all the occlusion parts are polished from the zirconia without the glaze. We close the screw channels with the plastic pins, and that's all. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more, and of course, don't forget to subscribe, like, and follow. Thank you, and see you next time.